Thanks very much for joining the Chief Medical Officer and I today. Today's statistics have actually just been published on the Scottish Government's website, given that today's briefing is a bit later than normal, so I'm going to quickly summarise these. 3,118 positive cases were reported yesterday, which is 11.6% of tests carried out. The total number of confirmed cases for the duration of the pandemic is now 277,335. As of today, 215 people are receiving hospital treatment. That's an increase of 13 since yesterday, and 20 people are in intensive care, and that is the same number as yesterday. Sadly, one further death has been reported, and that takes the total number of deaths registered under the daily definition to 7,713. And as always, my deepest condolences are with everyone who has lost someone as a result of the virus. Let me also briefly update on the vaccination programme. As of this morning, 3,781,887 people have received a first dose. That is an increase of 16,508 since yesterday. And 9,420 people got a second dose yesterday, which brings the total number of second doses now to 2,701,195. Now, today's case numbers reinforce the pattern that we have seen over the past week. There has been a much faster increase in cases than at any time since the start of this year. In fact, over the past 7 days, we have reported more than twice as many new cases as we did in the previous week. In recent days, the number of positive cases being reported has also been higher than at any previous point in the pandemic. It is, however, important to put that into context, and there's two contextual points that I think it's worth me making at this stage. Firstly, and before I make this one, let me be very clear that this is early days and we need to monitor this over the course of coming days. But when we look at cases over the past week by the date the specimen was taken, as opposed to the date on which we report the test result, which are the numbers we report on a daily basis, then what we see is a peak in cases last Tuesday. And since then, we have seen what appears to be a slowing down of the rate of increase. So that's encouraging, but again, I would stress that it is early days. We will want to monitor this carefully over the days to come and obviously see what that looks like a week from now. But the second, perhaps more fundamental point of context is that while we're comparing case numbers now to the situation at the start of the year, it is the case that at the start of the year, which was the last time case numbers were anywhere near the levels they are at just now, we were in much stricter lockdown. Far fewer restrictions are in force now. So the reality now is that without vaccination, the level of restrictions that are in place just now would undoubtedly be leading to far higher case numbers than is actually the case. So that is the first sign that vaccination is actually having an effect. But the number of new cases now is still a cause for concern, and it is obviously the main issue I want to talk about today. Before I come on to do that, though, in a bit more detail, I just want to confirm a change that we have indicated this morning in relation to travel. Because there is no longer a significant difference in case rates between Scotland and the following places, I can confirm that the travel restrictions relating to Manchester, Salford and Bolton are being lifted. However, restrictions will remain in place for now between Scotland and Blackburn with Darwin, where case levels remain higher than in these other three areas, but we'll undertake a further review of those restrictions over the course of this week. Let me return now, though, to the situation here in Scotland. As we have been saying from the start of this year, we're very much in a race just now between the virus and the vaccines. And our job is to do all we can to make sure the vaccine stays ahead of the virus. I should be very clear that we are confident, very confident, that the vaccines will ultimately win this race. The question is what happens between now and then. If over the next few weeks the virus gets ahead, unfortunately we will see more people become ill, we will see more people die, and we will see significantly more pressure on our National Health Service than will be the case if we manage to keep the vaccines ahead of the virus. The problem we've got just now is that the virus is running faster than it has ever done before. The Delta variant that we are dealing with just now accounts for the overwhelming bulk of all new cases right now, is significantly more transmissible than previous variants. And that is helping to drive the steep rise in cases that we've been seeing in recent days. On the other hand, and this is the positive part, we know that the vaccines are breaking the link between cases and serious illness. The nature of this wave of the virus is different, both in nature but also in impact than previous waves. And let me just illustrate that. Over the whole pandemic, round about 13% of all cases and 89% of all deaths have been in the over 65-year-old age group. However, because virtually all over 65s have now had both doses of the vaccine, that is changing, and it is changing really markedly. According to our most recent figures, those aged 65 or over are now accounting for just 2% of new cases, and what we've seen in recent days is that more than 80% of all new cases are in people under the age of 44. The impact of vaccination is also clear when we look at the data on hospitalisations. Back in January, more than 10%, perhaps closer to 13% of people who tested positive for COVID were being admitted to hospital within 14 days of the positive test. By the start of June, the start of this month, that had fallen to just 3%. In addition, more of those who are admitted to hospital with COVID now are being discharged relatively quickly. And again, that reflects the fact that most new cases now are in younger age groups. So in summary, fewer people who get COVID now need to go to hospital, and a higher proportion of people who do need to go to hospital are not staying in hospital for as long. So these two factors are helping obviously to cut down the serious illness impact of the virus, but also they are helping to protect the NHS from the full scale of the pressure that case numbers like this would have heaped on it before vaccination. And these factors are also what continues to give us confidence that vaccination is going to get us out of this, and that hasn't changed. That's why, notwithstanding this increase in cases that we're seeing just now, and obviously bearing in mind that we have to keep this under review, as we always have done, we do remain hopeful that we will be able to continue lifting restrictions, first on the 19th of July and then ultimately on the 9th of August. But, and this is the important but, how safely we get there depends on what we do now. This is a critical moment, and I really can't stress that enough. And over the next few weeks, it demands renewed care and vigilance for all of us. The virus, as we can see, is still out there. It's still potentially dangerous. Vaccination is very effective after 2 doses, but no vaccine gives 100% protection. And importantly, while we are vaccinating as quickly as we can, there are still a lot of people who do not yet have the protection of both doses of the vaccine. That obviously includes many younger people, and while younger people are less likely to fall seriously ill, they can still be badly affected, including, of course, from long COVID. And finally, while we know that a lower percentage of people with COVID are ending up in hospital now, the fact is that a lower percentage of a very big number of cases is still going to be a sizable number. So if cases continue to rise as they have been doing, we will see pressure on our NHS in the coming weeks, and our worry is that that will set back the work that is now being done to recover our NHS and catch up with the COVID backlog. So my appeal to everyone right now is a serious one. While we work hard to get people vaccinated, and more people are being fully vaccinated every day just now, please help us keep the virus at bay by taking care and following all of the vital health advice. I really do know everyone is sick of this, and I include myself in that. And I also know that many feel frustrated because we might think others are not taking this as seriously as we have been. But the fact is we are so close now, not just to seeing the light at the end of the tunnel, but to actually reaching the light at the end of the tunnel. And so having come so far, let's redouble our efforts just for a few more weeks to make sure that we get there and get there as safely as possible. So there are 3 key things in particular that each of us really need to do right now to help make sure we get to those milestones and get to those milestones with as little health impact as we possibly can. And I know everybody's heard this before, but I'm stressing it again for a reason. With case levels so high, it really is vital that we all play our part in slowing the virus down while the vaccines continue to get ahead and do their work. So firstly, please continue to follow the key rules where you live and all of the basic but really vital public health advice, for example, on physical distancing, hand washing and face coverings. Also meet other people outdoors as much as possible, particularly when the weather is a bit nicer. No environment is risk-free, but we know that outdoors is relatively safe compared to indoors. If you are meeting people indoors, please stick to the limits and open the windows to maximise ventilation. And that does apply if you're watching football or now, of course, with Wimbledon underway, the tennis. Good luck to Andy Murray for his next match and good luck to England tonight. But if you're planning to watch sport indoor with others, please remember that the maximum group size is 6 people from 3 households and the 3 households include your own. That rule is really important, and if we all stop and think about it, it's obvious why that rule is important. If somebody in your group has COVID but might not realise it, then if you've got a limited number of people and households in the house with them, then it's reducing the number of households that the virus might then be able to spread to. In addition, try to make sure that people from different households are sitting as far apart as is possible. And as I said earlier, keep windows open because that helps ventilation, and the better ventilated a room is, the less risky it is going to be. The second thing everybody has been asked to do is please get tested regularly. And that is especially important if you are planning to visit somebody. Test before you go, because you're helping not just to spot if you might have the virus, but you're obviously helping to protect those you're going to visit. Lateral flow tests are available through the NHS Inform website, but you can get them sent to you that way in the post, but also now you can collect them from local and regional test sites and also from your local pharmacy. If you test positive through one of these lateral flow devices, or if you have symptoms of the virus, make sure you self-isolate and book a PCR test as quickly as possible, and that is vitally important. If you are identified as a close contact of someone with COVID, you will be asked to isolate for 10 days, usually through a text message, so that gets to you as quickly as possible. Self-isolation is really tough. It's probably more frustrating now that there are fewer restrictions in place than it was earlier in the pandemic, but it remains vitally important to help us break chains of transmission. Thirdly and finally, our key and our ultimate weapon against this virus is the vaccine. So make sure you do get vaccinated when you're invited to do so, and make sure you turn up for both doses. If you're over 18, you should definitely have received news of your first appointment by now. If you haven't done so, go on to the NHS Inform website. You can self-register the new portal that allows you to do that opened yesterday, and that means your up-to-date details can be submitted and you will get an appointment sent to you as quickly as possible. You should also go to the website if you need to rearrange an appointment, or if you had your first dose 8 weeks or more ago and you want to bring your second appointment forward. I can't stress enough how important it is that all of us get vaccinated with both doses. It protects you, but it also protects your family, your friends, and anybody that you're coming into contact with. So please make sure you get both doses when you get the invitation. I think this is part of the collective civic duty we all owe to each other. But to be blunt about it, it is also our ticket out of this nightmare. So let's make sure we make full use of it and get out of this as quickly as possible. So these are the 3 points I want to stress. Get vaccinated when you're asked, test yourself regularly, and particularly if you're going to visit somebody or going for an outing somewhere, and continue to follow all the public health guidance. The current surge in cases is a concern. We're seeing it happening elsewhere as the Delta variant starts to take hold. So I'm not going to pretend it's not a concern. But I do know that if we all exercise caution and common sense, we can make a difference while the vaccine gets ahead. And I remain as confident, possibly even more confident than I have ever been that the vaccine is getting us out of this. So if we all just keep the heat, keep doing all the things we know we need to do so that we can look forward to the vaccine getting us back to normal sometime later this summer. So thank you very much for listening to all of that just now. I'm going to move to questions from the media who are joining us as usual today, and Gregor is with me and will help me with questions along the way. But first today I will go to Suzanne Allen from the BBC.
Thank you, First Minister. Hamza Yousaf criticised Rangers for not being more explicit and stronger in the condemnation of fans who gathered to celebrate their team winning the league. Celebrations which didn't appear to lead to a huge surge in cases. Today, Mr Yousaf told Good Morning Scotland that Scotland fans travelling to London on coaches and gathering to watch games is part of the reason for this week's record high infection figures. With that in mind, does the government regret taking a softly approach to Scotland fans travelling to the Euros and not asking the SFA to be more explicit and stronger in discouraging fans from travelling?
Look, we haven't taken a softly approach. We were very explicit in saying to fans who didn't have tickets for Wembley not to travel. We can't physically stop every person travelling, and significant numbers of people did travel, and I think there is an association between that and some of the cases we've seen in recent days. Public Health Scotland is doing more of an analysis of this and may publish some more detail in that in the coming days. So, you know, we asked people not to travel, and that was the case in terms of asking people not to gather in groups when it was Rangers winning the league a few weeks ago. Much of the criticism, of course, of Rangers after those events were about the damage and some of the, you know, the anti-Catholic abuse that was being hurled around that as well. And I think it's important that we don't forget that aspect of that. So I have almost literally every day for 16 months now asked people to do really difficult things. I've asked people to forgo things that they desperately want to do, and unfortunately we're still doing that. People have by and large responded magnificently, and we need to ask people to continue to do that for a little while longer. I do know that people, and again I include myself in this, get very frustrated when they see others perhaps not abiding with restrictions as rigidly as they are, and that contributes to a sense of why is anybody bothering. But we've all got a vested interest in getting through this next few weeks as safely as possible, because the end point is, I believe, firmly in sight. So however frustrated we are, however angry we feel at other people, you know, gets more difficult every day for everybody, but that end point is the one we should be aiming for, and I would encourage everybody to keep our eyes on that light, because we are, notwithstanding what we're seeing right now, we are definitely getting there because of the vaccine. Gordon Cree from STV.
Thank you. You've said today, and you've said before, that the vaccines appear to be doing the job of weakening the link between case numbers and hospital numbers. At what point do you think that publishing that daily number of cases no longer becomes useful information? Because the important bit surely is how many people are seriously ill. And if I can ask Dr. Smith, it's now nearly a month since the regulator approved the vaccine for 12 to 15-year-olds. What discussions have taken place since then with the JCVI? Because there are a lot of parents, particularly with children with particular health conditions, who are desperate for some news on that.
I'll hand over to Gregor on the vaccine in a second. I don't know right now at what point we will think it is appropriate to stop publishing the daily cases. It may be that people stop paying attention to them a lot sooner than we actually stop publishing them. What I'm pretty certain about is that if we were to stop publishing them anytime soon, we would understandably, I think, have journalists and others demanding to know why we weren't publishing them. The other point, which is perhaps more relevant here, is that the numbers going into hospital or intensive care or sadly dying only can be put in context when you see the denominator of the total number of cases. So that, you know, second set of numbers wouldn't really mean anything unless we were also publishing the case numbers as well. So I think At the moment, I think the more information that we can get out there to inform people's response and understanding of what is happening, the better. What we do know is that while I don't think it is right yet to be completely oblivious to case numbers, we are seeing less of a focus on case numbers than we were earlier in the year. I mean, if you think about it, when we had last time we had case numbers anything like this, we went fully into lockdown. We would never have tolerated case numbers at this level without strict measures earlier in the year because we had no vaccine protection then. Now, that's the contextual point I tried to make. We compare case numbers now to case numbers at the start of the year, but the contexts are completely different because we are not in lockdown now. We've got relatively few restrictions still in place. So if it wasn't for the vaccine, the 3,000 or thereabout cases that we're reporting right now, I don't know what they would be, but with no restrictions in place, they would probably be several times that. So the context has already changed because we are seeing that link between cases and serious illness weakening. But it's not completely broken, and it might never be completely broken. So we need to continue, one of the things that, again, I think there is evidence emerging that the vaccine has a positive impact here as well, but long COVID, people who might never end up in hospital, but still have quite a severe health impact from this, is still not fully understood. So I think at the moment, just in summary, the more information we can get out there to inform people's understanding, the better. But we have to explain that, the information that we're looking at today, we won't necessarily take the same action as we would on the back of the same information 6 months ago, because vaccination has really changed the game, and that is what is providing us. Even with what we're seeing just now in case numbers, I still feel reasonably confident that we will be able to meet the milestones that we set out just a couple of weeks ago. Gregor.
So I'm going to try to address both of your questions, Gordon, because I think just all that I would add to what the First Minister has already explained is WHO recently published new guidance in relation to public health and social measures, which recognise the changing context that we find ourselves in. Vaccination has been a complete game changer for the way that we assess the vast realms of data that we have that's in front of us. I think cases continue to be incredibly important to inform that context, partly because it allows us to see what parts of the population are being impacted by the infection just now, not just on an age basis, but also on a geographical basis as well. And it can allow us to kind of taper our response so that at all times it's proportionate to the type of disease that we're seeing there just now. But of course, other indicators are coming more to the fore now. So hospitalisation becomes a really important aspect of this because the link has completely changed between cases and severe disease just now. It allows us to understand much better what impact this is having on people. And with the type of age ranges that we're seeing just now, with the vaccine effect being maintained, particularly in those older age groups, what we can see is that there is a much weakened link between those raw case data and the translation through to hospitals. And that allows us then, as I say, to make sure that our response to that is much, much more proportionate. And a proportionate response is really important in every aspect of everything that we do. And that takes us to the issue of vaccination for children in particular, because when we look at the experience of children over the course of the last 16 months, we know from all the evidence that we've gathered that children are much less affected by severe disease than older people when they're infected by COVID-19. And that means that there are different considerations when we are assessing whether to go forward with a vaccination programme. The risk assessment becomes completely different for children compared to older adults. That's what JCVI has been considering over the last few weeks. They met again this morning. I expect that in the coming days we will hear more in terms of a statement from them, in terms of the way forward. But at this moment, what they are looking at is all the evidence, not only for effect and the potential benefits of vaccination in that age group, both from direct COVID harm due to the disease, but also some of the other benefits that may be derived, just general public health benefits from making sure that people are maintained in education for much longer, compared to any possible downsides of the vaccination programme as well. As I say, all that's been considered, and I expect, as I say, over the coming days, we'll hear more about that.
Thanks. Gerard Tubb from Sky News.
Thank you, First Minister. You've just come from your audience with the Queen, the first one for 2 years. There's been a lot of water under the bridge in that time. What indication did you get from Her Majesty that she agrees or disagrees with your position that the pandemic and everything else would be much easier to manage for the people of Scotland if the country were no longer in the United Kingdom?
As I'm sure you're more than aware, Gerard, the content of conversations between myself or indeed any leader of any of the governments across the UK and Her Majesty the Queen remain entirely private and confidential, and I'm not going to breach that privacy and confidentiality in any way. All I will say is that it was a real pleasure to see Her Majesty in person today. I think the last time I saw her in person was the best part of 2 years ago, so it was really good and hopefully a sign of that return to normality that I was able to have those conversations with her today and able to wish her well for her week here in Scotland. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, towards the middle and the end of this pandemic, you took a more cautious approach, and at that time the figures suggested that that was successful. Scotland was doing better in terms of case numbers than other parts of the United Kingdom. Over the last couple of weeks, that seems to have changed. Very high figures, for example, for cities in Scotland. Why, if the restrictions are being eased pretty similarly across the whole of the UK, why do you think that is in Scotland? And on something specific, if you look at the figures for the Blackburn area and compare them to, say, Dundee in Scotland, they're quite similar. So why are you banning people going to the Blackburn area and not restricting travel in Scotland?
Apart from Dundee, Blackburn with Darwin is still a fair bit above Scotland. But I said earlier on we're going to review that again over the course of the week. And I don't want travel restrictions in place between Scotland and any part of the UK or within Scotland. So we don't keep these in place for any longer than is necessary, as I think we have evidence today with our decisions around Manchester, Salford and Bolton. On your broader question, it's a very good question, and I'm going to have a go at giving you what we think are some of the factors at play right now, but I'll be candid, we can't answer it absolutely definitively. In the first 2 waves of this virus, what Scotland was, what I would describe in summary, we were a bit behind and below the curve in other parts of the UK, although we were all following the same pattern, we were behind and below. In this third wave, because I think that's pretty much what is now unfolding across the UK. We are slightly ahead and above at this stage. I would imagine that we may see that change over the next couple of weeks, depending on how things unfold in England and other parts of the UK. But that's where we are just now. Two factors, and Gregor will maybe want to say more about this. There are 2 factors in particular that may be influencing this, and put aside particular events that may have a sort of very temporary impact in cases like football supporters travelling to London. The more fundamental points, 2 points, and Gregor and I have discussed this at length, as you would expect. One, the Delta variant has, in England, seeded into, I think, Bolton, first of all. In an English context, size-wise, Bolton is relatively small. In Scotland, the Delta variant first seeded into Glasgow, which is our biggest city, so accounts for a much bigger part of our population. So therefore, the Delta variant was possibly able to spread more quickly and more extensively than in England in that early phase. The second point, and you can see what I'm about to see here reflected in the ONS weekly surveys, and it actually goes back to the point about the position in earlier waves. The most recent ONS surveys, unless there's been one more recent that I've not seen the detail of yet, but we have by around 8 to 10% lower population immunity in Scotland than in England and Wales, which may be reflective of the fact that fewer of us had the virus in earlier stages. So what that means is that right now, although vaccination will be evening this out on a day-by-day basis, But right now we have a slightly bigger, by about 8 to 10% perhaps, susceptible population, people who are still susceptible to getting it. So these are not absolute answers, but these are the factors that we think may be having an impact that is leading to what we're seeing right now. But Gregor can probably add to that.
I think it's really significant that we've got more susceptible population. If you like, the lower number of cases that we have seen up to this point means that there have been less people exposed, means that there are less people who are immune to the virus, and that gives a much greater pool of people that the virus can then infect. And as I say, 10% might not sound much, but that 10%, once you start to get a high number of cases, means that there are so many more possibilities for people to become infected as a result of contact with people who are carrying the virus. And that's probably a really significant influence on the higher case numbers, plus the fact the kind of population densities that we have in places like Glasgow, central Edinburgh, central Dundee, mean that when the virus does begin to show its effect in a more susceptible population, excuse the analogy, but the fire begins to run much, much faster and much, much hotter than in other circumstances. Those are probably the most important characteristics of why we're seeing this really rapid kind of increase in cases over the last month or so, but there has been some special cause in amongst there as well, which has perhaps contributed to that acceleration, such as the ability for people to come together more often.
The final point I would make was one I referred to earlier on, and you can go onto the UK dashboard and see these figures, and they're updated every day at 4 o'clock. But if you look at cases by specimen date, so we report a daily case, and then over the next few days they're allocated towards the date the specimen was actually taken. We had a peak in cases by specimen date last Tuesday, which was over, it was about 3,200 or thereabouts. In the days since then, and it is early days to know if this is a trend, that rate of increase appears to have marginally slowed. Obviously, last Tuesday, there was a worry it would just keep rising like that. So at the moment, we're seeing what appears to be a slight slowing of the rate of increase. But as I say, I could be standing here in a few days and that would look very different. But it's just to give a bit of context to what we are seeing right now. Jack Foster, Global.
Good afternoon to both of you. The new UK Health Secretary, Sajid Javid, has emphasised this term of a terminus date and says that the thinking from his perspective has to turn towards learning to live with COVID as opposed to the ambition of becoming COVID-free. I'm wondering whether or not you agree with that analysis and the sort of inevitability of his tone. And if Scotland isn't thinking that way, can we still be suggesting that July 19th is a serious prospect when we're describing today the situation as a critical moment still? Also, I wonder if I could ask to both of you, including the Chief Medical Officer, I'm sure you've seen the video of his English counterpart, Chris Whitty, being accosted in a park in London. I'm just wondering what your reaction is to that.
So just briefly on your substantive question about the virus, and I'll come on to Chris in a second, but when I describe this as a critical moment, and it's not because I at this stage, and I've been pretty candid all along, everything has to be kept under review, but the 19th of July and the 9th of August, when we set out those milestones, we tied them to vaccination progress, and I am confident that we're going to get there with vaccination, and therefore I remain confident that these dates will be met. But of course we have to keep the wider picture under review. When I talk about this being a critical phase, it's the period between now and then. How many cases are we going to have? How many hospital admissions are we going to see? How many people dying are we going to see? And how much pressure on our NHS? So at the moment, it's not about it's critical because we might not be able to meet those milestones. What I'm talking about, it's critical in the sense of how safely do we get to those milestones. So that's my sort of view at the moment, and obviously if that changes, I will stand here and tell people why I think that has changed. In terms of Sajid Javid's comments, congratulate him firstly on his appointment as Health Secretary in England and UK Health Secretary, but we published, was it last week? I think it was just last week before Parliament rose for the summer recess, our revised strategic update, which moved away from the language we had used to suppressing to the lowest possible level to one that says we suppress now to a level that alleviates the harms. And basically that is taking account of the impact of vaccination, and that we are going into a phase where just case rates are not what drives all of our decisions. It is about the translation from case numbers into hospitalisation. I've got a little bit of a reluctance to talking about just learning to live with it, not because I don't agree that in substance we need to find a way of doing that. I think that phraseology can sound a bit glib to people who have lost someone from the virus, or who might still get the virus and get long COVID. But there's no doubt vaccination is changing this game, and that makes me, notwithstanding the increase in cases we're seeing right now, still confident that those milestones and the return to normality can be achieved. But obviously, the lower we keep case rates, then the fewer people are going to get this and risk being in hospital. If we're only getting 3% of cases going into hospital now, as opposed to 10% at the start of the year, that's obviously a big improvement. But if it's 3% of a very high number of cases, that's still a lot of hospital admissions. And that's a lot of people getting sick and a lot of pressure on our health service. So that's why we can't yet be completely complacent about case numbers. And I'll hand over to Gregor, who wants to say more about his colleague Chris Whitty. I can't find the words strong enough to deplore and condemn what I saw in a video last night, with the way in which Chris Whitty was being abused, actually manhandled by people out in public. For anybody to face that is appalling. But Chris Whitty, I obviously don't work with Chris Whitty on a day-to-day basis directly. Obviously, I've had interactions with him over the course of the pandemic, but I do work with Gregor on a day-to-day basis very closely. I know how hard our clinical advisors are working right now in the interest of getting the whole country through this, and they deserve our gratitude and support, not abuse from a mindless minority. So I'll just send Chris my good wishes today, and encourage him to keep doing the fantastic job that he has been doing. Gregor.
I think all I would confine myself to saying is that Chris is a person that I've got a huge amount of professional and personal respect for, both in the way that he has conducted himself generally over the course of the pandemic, but just in the qualities that he brings from a professional perspective as well. I was in contact with him earlier on today. We spoke about what happened. He knows that he's got my support. Unfortunately, these things have happened from time to time over the course of this pandemic, when various professional advisors have found themselves on the receiving end of some sort of abuse. I think it's appalling what happened to Chris, and as a society we should condemn it.
Many thanks, Gregor. Alan Smith from Bauer.
Thank you, First Minister. Just on the rising number of cases that we're seeing, are you confident that Test and Protect has the resources it needs to cope with the current levels of cases we have just now? Because there is a suggestion that perhaps it's struggling to keep up with the rising cases, with it taking longer and longer to contact people, and there are calls for greater resources to be put into Test and Protect in Scotland. And just secondly, if I may, could you update us on the discussions you're having regarding self-isolation rules for pupils, and whether or not they'll change for when pupils return after the summer break?
Thanks, Alan. Briefly on Test and Protect. Test and Protect obviously comes under much more pressure the higher case numbers are, because, bluntly, there is more work for it to do. And we have a duty and an obligation to monitor that, to make sure it has the resources it needs. So Test and Protect will have been working under much more pressure over the past week than it has done at any point since probably the early part of this year. And I'm not complacent about that. But if I look at the most recent figures for week up to the 20th of June, so obviously we'll have an update on this shortly, against the WHO criteria of 80% of new cases having close contacts traced and in quarantine within 72 hours of case confirmation. The kind of proxy we use for Test and Protect, the definitions are not exactly the same, but against that 80% target, up the week up to 20th of June, the performance for Test and Protect was 95.4. So it's meeting that target, but we continue to assess. And obviously Test and Protect will also, like any organisation and system like that will do. They will flex their resources to make sure that they are meeting the greatest need. They're making much more use of text messaging, for example, so that somebody who's been asked to self-isolate is getting that notification as quickly as possible. On the second part of your question, I've got no substantive update to give on that today. Obviously, our schools are on holiday now, but before they go back after the summer period, and in fact in the lead up to them going back, we will want to give as much clarity as possible about the mitigations that will be in place. And of course, we are considering what the position might be with isolation, but it's important that we consider that carefully, and our education advisory group will be key to those considerations. And, you know, as was indicated earlier on, we are still awaiting the advice from the JCVI about the possible vaccination of young people over the age of 12. But I don't know if you want to add, Gregor.
What I want to say, Neil, I mean, when people think about a response to COVID-19, maybe some of the images that they instinctively think about is the pictures within hospitals of ICUs, of emergency departments, and the way that the clinicians within the hospitals help people when they're particularly ill. But we really can't afford to forget perhaps some of the forgotten heroes that are about the system across our community healthcare services, and particularly in our public health teams, who've been responding for many, many months now in a huge way, making a massive contribution to how we protect people from the kind of continuing COVID-19 challenges that we face. I guess what I want to do just now is just thank everyone in the contact tracing teams and public health teams across the country and across community healthcare services for everything that they continue to contribute. I realise how busy these teams are just now. One of the features that we're occasionally seeing more often now being reported from these teams is that when they're contacting the public and asking them to isolate, there are more often cases of people beginning to be abusive to them. I ask people, please be patient with these teams when they contact you. Listen to what they have to say. They are trying their very best to make sure that we're all remaining protected from COVID-19, and please heed their advice when you give it to them.
Neil Pooran from PA.
Thanks, First Minister. In terms of this recent surge we're having in cases and the potential link to people coming together to watch football, to watch the Euros, is this something that's also coming through in the test and protect data, and is it something you're maybe considering issuing further guidance around? In particular, I know this morning the Health Secretary mentioned there was a number of cases that were linked to coach travel, people going on supporters buses down to London and back, and that being high risk. Are there sort of lessons that you're learning at this point that you might think we need to take forward as the pandemic continues?
Anecdotally, I think it is the case that in terms of travel and people gathering indoors to watch football, we are seeing some association between that and cases. I'm saying anecdotally at the moment because I think I mentioned earlier on Public Health Scotland's doing some further analysis of the different settings in which people might be watching the football and trying to work out if that is having an impact, and I think they may publish that work in days to come, so that may give us a more complete picture. But you know, obviously what we're talking about here is people watching football, but it's not the football that is the factor here. It's when people come together in indoor enclosed spaces, whether that's a coach or a train or somebody's house, to do anything, then that is riskier than not doing that, and it's riskier than gathering with people outdoors. So are we trying to, you know, factor that into our thinking as we go? Yes, it's why I have today taken the opportunity to remind people, if you're gathering together to watch a football match, if you're maybe doing that tonight to watch a particular football match, then remember the limits, the household and overall number of people. Because the fewer households we're bringing together, if somebody in that group does have COVID, then you're limiting, it's almost a kind of natural fire break. You're limiting the number of households that are then going to take that virus away. So it's really important, whether it's football or tennis or just getting together with your pals, it's really important to stick to those limits just now. And remember to take a lateral flow test. If you're going to visit somebody else's house, or if you're going to meet, you know, your pals for a drink somewhere, take a lateral flow test, and that just gives that added degree of protection that if you maybe have the virus but you're not showing symptoms, then you can pick it up and then avoid inadvertently passing it on to others. So that's a really, important. None of this is foolproof. This is an infectious virus. There's no guarantee that any of us don't get it or pass it on. But these are just different layers of protection that we can add to reduce the potential.
When the test and protect teams are having the conversations with people who test positive, one of the things that they do is they use certain tags to kind of try to kind of work out different associations for environments, places, situations that people have been in, so that we can track those over time. Now, the test and protect teams have been using a tag which has been associated with a variety of different scenarios that might be associated with the European Championships. Public Health Scotland are analysing that data just now. I expect that to be published very soon, and that will give us a clear indication of the type of scenarios that are perhaps higher risk of an association with cases. We can't say that they cause the cases, but certainly there might be a strong association with certain types of scenario, and I expect that in the coming days.
And I repeat, although it never does me any good, this is not having a go at football. It's not blaming football. I mean, football over the last couple of weeks, even for Scotland fans, has brought a bit of cheer and happiness. So it's not about blaming football. This is about people coming together for whatever reason in enclosed circumstances, and that's what we've still got to take care over. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Given the case numbers where they are, and you and the Health Secretary there doesn't seem to be any appetite for sort of reimposing restrictions, do you think it's safe to say that Scotland's seen the last of lockdown? So, no return to sort of closed schools, closed shops, closed pubs, but also just secondly, East Lothian's got the second highest case rate in Scotland, and it's in level 1. Obviously, a lot of areas in level 2 with much lower rates. Is there a case for sort of doing away with the level system early and perhaps moving the whole of the country down to level 1? Thanks.
Well, we're hoping to move the whole country down to level 0 on the 19th of July, and I think that's the target we should stay fixed on right now. Whether or not we have to pause easing of restrictions or, heaven forbid, because none of us want to go here, put on more restrictions, is not about the extent of the appetite I have for that. I've never had an appetite for placing restrictions on how people live their lives. It will come down to an assessment of whether that is necessary to protect health and life, and hopefully we will reach the judgment over the period ahead that because of vaccination it's not, and vaccination is what is changing this. Right from the start, I have hesitated in saying anything looking ahead with 100% certainty, because this is an infectious virus that behaves in ways that can often be unpredictable. I got criticised for not, back at the start of this year, declaring the 21st of June as Freedom Day, because I just didn't think it was possible to look ahead, and it turned out it wasn't possible to meet that. And so every fibre of my being hopes that we never have to impose another restriction, and that the direction of travel now is to lifting the relatively few remaining restrictions that are in place on the 19th and then on the 9th of August, and that we will never have to put another restriction in place again. That is what I hope, and that is what I hope vaccination will deliver. But if I was to stand here right now and pretend that I could say that with 100% certainty, I wouldn't be being straight with you or with anybody else who was watching. So let's just keep doing everything that we know makes the difference, particularly getting vaccinated. And my levels of confidence that we won't ever go backwards to restrictions is higher than it has ever been at any stage so far. Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Could you just briefly return to this issue of travel restrictions with other parts of the UK? Obviously, the announcement today has been welcomed by Andy Burnham, but there's been quite a sort of large focus on the case numbers when decisions were made around this. But can I just clarify what other factors were involved? For instance, were you looking at things like vaccine uptake rates as well? Was that something that was part of the considerations going forward?
We have been looking at case incidents in terms of making decisions around travel restrictions. Nobody wants to impose travel restrictions. It is not done for any other reason than public health. So when we imposed the travel restrictions in Manchester and Salford, there was Scotland was lower than those areas, and we were still at that stage trying to protect against more of the Delta variant. Now, in terms of Manchester and Salford, the gap is not significant. That's unfortunately not necessarily because of improvements either in Manchester or Salford in Scotland, but because the recent increase in cases in Scotland. In Bolton, I think there has been an improvement, and case rates in Bolton have been going down. So that's the data we've been looking at. Vaccination rates, I think, do become part of considerations around this, although they haven't been formal parts of the consideration so far. But if they had been, it probably would have reinforced rather than undermined the decision we made just over a week ago, because in some parts of Manchester, I think vaccination rates there are a bit lower than they are in Scotland, although of course everybody's vaccination rates are going up every day. So these are not easy judgments to arrive at, and when we have widespread community transmission, the efficacy of travel restrictions reduces. But often when you're in the earlier stages of an increase, travel restrictions can be one of the tools you use on a targeted basis to try to stem it. So, I'm not ruling out doing that in future if we need to, but obviously we don't want to have to do that if we can possibly avoid it. Christine Lavelle from The Sun.
Thanks, First Minister. Just regarding the considerations that will be given to isolation rules for school pupils towards the end of the summer holidays, I just wondered, will a similar consideration be made for the wider public, for people who are identified as close contacts of positive cases? For instance, could it be replaced by a system of daily testing? And just a question for the Chief Medical Officer, if it's okay. Just regarding again what happened to Professor Chris Whitty, you kind of touched upon this in your answer, but I just wondered, have you or your health colleagues faced any similar incidents like this since taking up such public-facing roles during this pandemic?
I'll hand over to Gregor in a second. Briefly on isolation, so I think everybody accepts there have been particular issues around isolation with school children because of the large numbers that have ended up isolating and the impact on education. So before the start of the new school term, we want to have a really good think about this to come to a position that we're confident is the right one for the interests of children overall. There are similar considerations more generally in terms of the use of isolation. I think I indicated this in Parliament last week, that for the foreseeable future, I think asking positive cases to isolate in order to break chains of transmission is going to be a feature of Test and Protect. But we have to think about how much longer and on what basis contacts and people around positive cases might have to isolate. Now, there are different factors. We have not reached any conclusions on this yet, but there are different factors. Vaccination levels obviously are important. The use of testing might be important, but also, as we hope will be the case, we are reducing and then ultimately removing the requirement for physical distancing. What constitutes a contact will change as well. So it's really important that we think through all of these things, but that we take the time to do it sensibly and make sure we arrive at sensible judgments.
Christine, I've not faced anything like has been reported that Chris Whitty experienced recently at all, and I'm not aware of any of my colleagues at all who've experienced anything like that either.
Thanks. Helen McCardle from the Herald.
Hi, afternoon, First Minister. Just a straightforward question. The last figure I've got for the Delta variant prevalence in Scotland was that it was about 3/4 of cases. It was 75%. Do you know what the most up-to-date figure is for what percentage of cases now we can attribute to Delta?
It's higher than that now. Gregor might have the up-to-date figure.
We've been tracking the S gene positivity just now, and at the moment S gene positivity, which is a very good marker for the Delta variant, is currently running fluctuates between about 90-95% of the isolates that we're getting just now. So by far the predominant virus that we're seeing, and it's almost certain that the majority, if not almost all of those S gene positive cases just now are in fact Delta variant.
Michael Blackley from the Mail.
Hi, thank you. Good afternoon. Just on the Manchester and Salford travel ban again, it only actually lasted just over a week. Do you still believe that that was a proportionate measure, or was it a mistake? And would you be concerned if any other parts of the UK were looking at Scotland's numbers now and considering restrictions on people travelling from Scotland? And if I could also just ask about issues around holidays, do you expect there to be a change to allow people that have received 2 doses of the vaccine greater freedom to travel at any point this summer? Thanks.
So yes, I do think it was a proportionate measure when we took it. Interestingly, and this is there's not really been much focus on this, but at the time we restricted travel to Manchester and Salford, the Greater Manchester website was also recommending limiting travel in and out of the affected area. So actually, substantively, whatever disagreements there might have been about process around this, substantively, the advice seemed to be broadly similar, albeit ours was in regulation and it was simply advice in Manchester. So I do believe it was proportionate given what we were facing, but the fact it has only been in place for a week demonstrates one of the other points we have made repeatedly, that we don't keep these restrictions in place for any longer than is absolutely necessary, because nobody wants them to be in place. The idea that I take any pleasure or reach decisions for anything other than public health considerations in terms of restricting travel from Scotland to anywhere is just nonsense. So they are proportionate and time limited for only as long as necessary. And, I'm focused right now on supporting all of the efforts we need to make to get case rates in Scotland on a downward trajectory again. But do you know what? Having lived through this as a leader of a government for, 16 months now, I support any government leader taking proportionate steps to keep their population safe. And I'm not going to, unless there was evidence that they were doing it for wrong motivations, I'm not going to criticise any leader of any government or any part of the country for taking decisions that are motivated genuinely by public health considerations, because that's the job and the duty we all have right now. But I certainly want to see, and my job is to focus on steering Scotland through this particular phase as quickly as possible. And on the point about double vaccination for international travel, we haven't reached a final decision on that yet, but I do hope that we will see vaccination open up international travel safely as well over coming weeks. Do you want to add anything?
Yeah, I think we all know the benefits that vaccination has brought to the population. We see them, we've spoken about them even over the course of the rest of this briefing. We know that it is protective against severe disease. We know that it has an impact on transmission as well. It's therefore inevitable that over time, when it's safe to do so, we'll begin to evolve the rest of our strategies so that we can begin to open up society more on the basis that we've got so many people across the country double vaccinated. And I would anticipate that once we kind of begin to complete those adult vaccinations towards the, as we go through further into the summer and to the early autumn period, we'll be looking to see how we can introduce much greater freedom based on your vaccination status.
Helen Puckett from The Times.
Thank you very much. I just wonder if I could ask about the Manchester situation as well. Not meaning to suggest the measure was motivated by anything other than public safety, but can you explain the logic of people being more able to go to Manchester now? Now we have more people in Scotland infected with COVID. It just seems a bit against the normal way of things to say, actually, now we have more, you can travel. That seems the opposite of what we've been doing throughout the pandemic. And the second thing I just wanted to ask about was vaccinations. If you try and rearrange your COVID vaccine in the Lothians today because you can't make a date, you cannot get an appointment, it's all fully booked. Now, you can turn up at some centres, but that's not available on the system, it doesn't tell you that. So should people be rearranging their appointments and waiting for blue letters, or should they now be turning up for second vaccinations? Which should they do? Thank you.
On the first point, what we're doing is exactly what we've been doing on travel restrictions all along. The point of travel restrictions, and people who've been faithfully following all of this over the past few months will have heard me say this, it's about restricting travel from low prevalence to high prevalence areas and vice versa. So when we took the decision about Manchester, Scotland was lower prevalence than Manchester and Salford, so it was about trying to restrict the further importation into Scotland. When you've got areas that are pretty much eeksy-peeksy, forgive the non-technical language, there's no point in restricting travel because you've got parts of the country, or in international travel sense, different countries at the same level. So that's exactly how we have done it, and it's the approach we apply to international travel as well. On the vaccination point, I'll look into the detail of the situation around Lothian, but we are deliberately trying to give as many routes into vaccination as possible. So if you've got an appointment for your second dose and you're happy with that appointment, turn up. But if it is a bit after the 8-week point, it is worth going on to try to bring that forward. Obviously, there are limits to the supply and the appointments that we can then support with supply on any given day, but you can try and bring it forward. And if there are drop-in clinics allowing you just to turn up, I would say, if you're able to, turn up. This is about giving people as much choice as possible to get their vaccination as quickly as possible. Elsa Maishman from the Scotsman is the final question.
Thanks, First Minister. Just another question on the vaccine rollout. I don't think anyone would dispute that it's going well, but as you said, the pace is really important at the moment. Last week saw the lowest weekly doses since early March. Why is that? And maybe the same question, what is the limiting factor on the rollout? You said a couple of times that it's supply, but if that's the case, then why did Wales get 80% of the population a first dose more than 3 weeks before we did? The gap's closed a bit now, but obviously that will affect when people get their second doses. I asked the Scottish Government and they've told me the issue isn't staffing shortages. You said yourself missed appointments aren't higher in Scotland. So I'm just wondering, what is the difference there?
I can't speak for Wales, and I'm sure the Welsh Government would explain the system they're using. I can only speak for Scotland, and I know we have been vaccinating as quickly as possible with supplies. Particularly with Pfizer, the complicated storage issues means that we've had storage capacity. We've needed storage capacity, but we've done it as quickly as possible. And our vaccination rates in terms of first doses are broadly in line with England. I think certainly the last time I looked yesterday, this changes a little bit on a daily basis, but our first doses are slightly ahead of England. So I know we're doing it as quickly as we feasibly can. Your question is really relevant for a separate reason, which is what is the limiting factor now? Obviously, the first and absolute limiting factor is always going to be on supply. But as we go into doses, there's another limiting factor, which is the 8-week time gap between first and second doses. So if you look at second doses today, they are lower than they have been in recent days over recent weeks. That it will partly be supply, particularly around tightness of some of the vaccine supplies, given that we can only give Pfizer to younger age groups. But the other limiting factor there is the number of people who would have got their first dose 8 weeks ago. So if you go back 8 weeks from today, you will find that, at that point it was supply. The daily number of first doses was relatively low. So what we're able to give 8 weeks on is kind of limited by the number of people who had first doses there. So in the second dose part of this programme, supply will always be a limiting factor, but the gap that we need to leave between first and second doses becomes a limiting factor as well, and will to some extent be dependent on what the supplies were 8 weeks ago. So I know that sounds complicated and I probably didn't explain that very well, but hopefully you got the thrust of what I meant. Do you want to put that into English?
So the number that we're seeing on a daily basis just now is a factor both of supply now, but also this available supply 8 weeks ago when these people were getting the first doses. And if the supply was low 8 weeks ago, then you don't have the available pool to be able to vaccinate. Just now, it's as simple as that.
So hopefully that makes some, I know it makes sense, but hopefully we explained it in a way that makes some sense to you. Sorry, Elsa.
Can I just, very quickly, I apologise, just follow up on that. You mentioned the gap between doses. With Pfizer, it's possible to give the second dose 3 weeks after the first dose. Is there any consideration that we might be able to shorten that gap even further?
The clinical advice right now, I'm going to hand over straight away to Gregor, but the clinical advice right now is we shouldn't reduce the gap any further than 8 weeks, because I think some of the evidence is maybe going in the opposite direction than previously.
Elsa, as you probably know, the JCVI have looked at this very, very closely, looking at the optimal interval between doses. Now, the first recommendation was to have it at 12 weeks, and the reason for that is because we theorised that there would be a much better immune response. That's shown itself to be true in the studies that have been done since that point in time. What they show is that you get a much greater level of particularly antibody response by that extended gap. Now, they chose to reduce the gap from 12 to 8 weeks a few weeks ago because they were balancing the risk between the presence of Delta and the speed at which we wanted to provide that second dose protection, but also still trying to maintain as high an antibody response as possible. That antibody response is really important, both for the effectiveness of the vaccine, but also for how long that effect lasts as well. And if we were to reduce that below the 8 weeks, the assessment of the JCVI just now is that you begin to particularly compromise and reduce the length of time that people would be protected for. And that would mean that they're less likely to be protected as we go into the next winter period. That's not something that any of us want to see just now. So preserving that 8-week gap just now is the best balance between protecting people as quickly as possible, but also making sure that that protection is great enough and long enough for them to be useful for throughout the rest of this year.
Thanks. These are really important questions because, that question that you've just asked there, Elsa, is one that I've asked Gregor before. Can we vaccinate people with their second doses sooner than 8 weeks? But the very clear advice is that the optimal is to stick to 8 weeks. That concludes the questions today. Thank you to everybody, all the journalists for joining us, to Gregor and Yvonne for our interpretation, and thank you to all of you. The case numbers, for anybody paying attention to these, look a bit scary at the moment. I don't doubt that, and we shouldn't be complacent about it. But we are in a very different place now because of vaccination, and we are not seeing the commensurate increases in hospitalisations and number of people dying. So that is positive, and it still means that if we hit our vaccination milestones, as we are confident we will do, then the projected outlook is a good and a positive one. But how safely we get from here to there depends on what we all do right now. So please remember to stick to all of the advice, particularly if you're watching the football. Please test yourself regularly, particularly if you're going to visit somebody, and get vaccinated as soon as you get invited, and make sure you come for 2 doses. That is our ticket out of this, and we need to make sure as many of us take it as possible. Thank you very much indeed for joining us today. We'll give further updates over the course of the week and notify you of these as necessary, but thank you for now.